Okay, guys, we are back. I apologize. My allergies are going crazy right now, but let's get right back to it. So, if you are joining us for the first time, welcome. If you're joining us again, welcome back. I am reading Project 2025 on here. I started reading this back in July. It kind of took off for a little bit, and then I just didn't think there was going to be a need for it. But guess what? I was wrong. And Project 2025 is here. So I am reading the mandate here live on TikTok. And if you go through it, only subscribers can comment. So it filters out, because it was just literally I couldn't answer any questions. I couldn't see anything because people just went through and went MAGA. And yes, for those of you who did ask, I did put in a new goal, because whatever this trash panda thing is, because every time it hits a goal, it like stops and says, hey, you need to change your goal. So I didn't do that. So let's kind of get into where we are. I have gone through and read all the way through to the beginning of chapter 12, but I'm skipping to chapter 14, which is the Department of Health and Human Services, because I think these are the things that are going to be the most talked about. These are things that are going to affect people the most. And yesterday we read pages 449 through 459, and it was talking about everything that HHS is going to do. Now, people will say it's been disproven. It's not. It is his agenda. Project 2025 has evolved to America First. Oh, thank you for the crown, Manny. I appreciate you. Again, guys, sometimes I see your gifts, and if I see them, I'll try to recognize you right away. But you don't have to gift. You can if you want to. I appreciate that. It lets me do what I do, but it's never expected. So, with that being said, thank you for the hearts. I appreciate you. Feel free. Oh, my first dumpster fire. I like the dumpster fire. I'm not going to lie. Make sure that we are hydrating, guys. Today, this is brought to you by Sprite Zero Sugar Winter Spiced Cranberry, because yes, I love diet soda, but make sure you are also getting enough water to drink. Feel free. Thanks for joining the team, Exile. I appreciate you. If I don't see you guys gifting, if I don't see you guys join the team, or if I'm not reading any comments, I apologize. I am just trying to read through this. We only got through 10 pages yesterday. But if you miss it here, I'm going to go through at a later time and upload them to my YouTube channel. Thanks for joining the team, Jeffrey. I appreciate you. Whatever was that? Apologize. So if you want, the link in my bio will take you to my YouTube page, and that will go through the first 11 chapters, so we can see what we're talking with. Thank you for joining the team, April Andy. I appreciate you. Okay, first things first. I know a lot of people are like, what is happening? What is going on with this man's cabinet? Where does this leave us? And probably the biggest one right now you're looking at is Matt Gaetz. So Matt Gaetz has now been nominated for Attorney General, and it could not be the worst pick ever. Thank you for joining the team, Dottie. I appreciate you. Thank you, Bubba. Thank you, guys. Sorry, I get distracted by shiny things. I have a horrible ADHD, and I'm like, ooh, what did they say? So, I appreciate it. Thank you so much. Thanks, Trey, for joining the team. I appreciate you. Thank you for the rose. Thank you for the gifts. Thank you for the hearts. If you miss any of this, feel free to go listen on my YouTube. I know it's a lot to take in, and I do try to read and kind of have conversations about that piece at that time. I'm waiting to upload 14 until we get all the way through 14 together, okay? So we'll just kind of do like a quick refresh of what we talked about yesterday in Project 2025, in the mandate, in America First Leadership, in Agenda 47. This is what Trump is doing. This is what he's doing. It's what he's doing. Whether you like it or not, this is what it is. And people say, he didn't say that. Honey, I think we're past the time of being in denial at this point. So, chapter 14, page 449 through page 459 is where we were yesterday. And we talked on, and I'll briefly give a summary on this. We talked about empowering patient choices for provider autonomy, where they talk about abortion is not a thing. They want to completely ban it altogether. Stable, flourishing married families are talking about how even if you're in a bad marriage, you should stay in it because they're going to get rid of no-fault divorces. Greater transparency and accountability for the next pandemic, which will be inevitable if... Oh, thank you for the heart hands, Jeffrey. I appreciate you. Again, sorry guys, I get distracted by shiny shit, so bear with me here. talking about, the proper balance of lives saved versus souls saved. So it's always tied into religion. It's always tied into Christian nationalism. It's all tied into it in the Transition Project. It is. And what we were talking about yesterday before I left was we were talking about abortifacients. Things like mifepristone and misoprostol. Sorry, I got a notification. Thank you for joining the team, Crystal. I appreciate you. When we're talking about the FDA and they're talking about what they want to do as far as like getting rid of abortion pills. But remember, one of the main uses for things like mifepristone and methotrexate, things like that, it's not just abortifacients. They're not just chemical pregnancies they're trying to get rid of. People use this for rheumatoid arthritis and cancer and Crohn's disease, and doctors are going to be terrified to prescribe this because they're going to think that that's what they're using it for, and it's not necessarily what they are using it for. And if it was, it's none of your fucking business. But number two, they're trying to get rid of it altogether. So they don't even want you to be able to order it through the mail because they're going to use the Comstock Act of 1873. I know. So 40 years before women could even vote, that's what they want to do. That's what they want to take apart. So when we stopped, we were talking about, I'm going to go to the very bottom of page 458, if you're following along, mail order abortions. Allowing mail order abortions is a gift to the abortion industry that allows it to expand far beyond brick and mortar clinics and into pro-life states that are trying to protect women, girls, and unborn children from the abortion. No, it's medical care. But okay. It says the FDA therefore should reinstate earlier safety protocols for mifepristone that were mostly eliminated in 2016 and apply these protocols to any generic version of mifepristone. So not only do they not want you to have it, if you have to have it, they want you to have the generic. They don't want you to have the brand. A bare minimum policy of limiting abortion pills to the pre-2016 of 49 days gestation, returning to pre-2021 in-person dispensing requirement, and returning to requiring prescribers to report all serious adverse effects, not just deaths, to the drug sponsor would increase women's health and safety. So when they talk about mifepristone and going to the generic version of mifepristone, it's again, that's more control. Thank you for joining the team, Divatrix. I appreciate you. So they're trying to, it's control. If they know because when you have a brand name and when you have a generic, you have a bigger inventory. If they only go to the generic or they only go to the brand name, they can track it more. They can track it more. They can only dispense X amount. That's why when you get like medications, they'll be like, sometimes you'll get the brand or sometimes you'll get the generic. And so they'll say, because the brand is higher, and sometimes the brand is the brand because they haven't released the patent on it yet for it to be generic, so it's not cheaper. And that's what companies do. That's how pharmaceuticals make money. Thank you for joining the team, Nancy. I appreciate you. Thank you for the calendar. So when you limit, if it's a generic or a brand name, you also you streamline that actual dispense. So there's a limited amount and they can tenure it. So address weaknesses in the current FAERS FDA adverse events and reporting systems. The administration and policymakers should ensure that healthcare workers, particularly those in hospitals and emergency rooms, report abortion pill complications. Women who experience complications from abortion pills typically go to an emergency room, not to abortion pill prescribers. So putting the onus of reporting on the prescriber, who typically has no idea that a complication has occurred, means that FAERS is seriously undercounting these adverse events. Submitting an adverse event to the database should be a quick and efficient process for busy healthcare practitioners. Currently, providers report that the process is difficult and convoluted. So again, what they're saying is, okay, if you have an issue, go to ER. It's data collection. That's what it is. So if you are talking with your OB or you are talking with Planned Parenthood and they send you the abortifacient and it is for abortion purposes and something happens, usually you go to the ER, but a lot of women aren't going to tell you why they're going to the ER now because they're afraid they're going to get in trouble. They're going to go to jail. It's going to be a crime. So they're like, they're reporting it because a lot of women who, if they have adverse effects, are going to call who prescribed it. So again, more control, more data collection. Implement a policy of transparency about inspections of the abortion pill sponsors, Adanco and GenoBioPro, as well as facilities that manufacture the pills. The FDA should respond to Congressional Requests and Freedom of Information Act, that's FOIA, about inspections, compliance, and post-market safety in a timely manner. Again, data collection and control. So, stop promoting or approving mail-in abortion in violation of long-standing federal laws that prohibit the mailing and interstate carriage of abortion drugs. Right there. Vaccine importations. Thousands of Americans and faith conscience wish to receive various childhood vaccinations for themselves and their families, but are not allowed to receive vaccines that are derived through or tested on aborted fetal cells. This is just, guys, people who are writing this or have been writing this are literally to the hilt with any vaccinations they would need. Thank you for joining the team, Annie. I appreciate you. So they're like, oh, well, right here, I want to make sure that we curb those vaccines because it could be from aborted cells. Meanwhile, there are senators and congressmen who have used stem cells from aborted fetuses, but it's not, people aren't having some abortions to just give the cells to actual medical companies. No, it's for medical research and only when requested and given authorization for. So, let me see. For example, the chickenpox, hepatitis, and MMR vaccines in the U.S. are all linked to abortion in this way. The way that this is written, and this is what also scares me. If you see the fact yesterday that, like, the astounding fact that 50% of this entire country reads at less than a 6th grade level is another reason that I'm going to read this to you. It was the... Oh, thank you for joining the team, Queen Flea. I appreciate you. It was something to the effect of, like, 60%, and if you find you guys, let me know. Hi, Halo, I love you. It was something to the effect of, like, 60% of all parents cannot read a simple story to their child at night. This is heartbreaking. Thanks for joining the team, Lorraine. I appreciate you. So when I have the chance to read and can actually tell you what this says and what that means, it was also like they can't even read a basic pill bottle. So I think literacy should be at the forefront, and this whole get rid of, like, the Department of Education, what she talks about in here is fucking stupid. It needs a revamp for sure. But when you are sitting here saying that 50% of people cannot read in the United States, how many of those are voters who literally were like, I just see one name and ... They didn't read any of the bills. They don't know what the bills are. They couldn't read it, and that's terrifying. And I want to be able to help with that process because this is daunting. This is, if you guys have never seen it, this is one of the folders. And here's the other one. It's 922 pages long. Okay, it's daunting. And there's no pictures. There's no. You read it along, and we're reading along together. But I said I wanted to get through chapter 14 so that I could upload that to YouTube and then go back and do 12 and 13 after that. So there are ethically derived alternatives abroad that have been used for decades, but the FDA is making it exceedingly difficult for Americans to import them. In January 2021, the HHS Office of Civil Rights, the OCR, and the FDA jointly announced that the HHS was going to require the Religious Freedom Restoration Act, the RFRA, to allow bulk importation by doctors of certain Japanese-made vaccines to accommodate religious needs of patients, but the Biden FDA unlawfully revoked this waiver. The FDA should restore the waiver to comply with RFRA and for the obvious public benefits of increased childhood vaccination from families seeking to ethically derived alternatives. Oh, so now you want to choose which vaccines are which. Now you want somebody to pay for what vaccines, even though we have deemed them safe, you want ethically derived ones. So you agree that you should be taking them, but you don't want to take ones from what you believe are aborted fetal cells? Thank you for the heart. I appreciate you, Divatrix. The FDA should restore the waiver with RFA for the obvious reasons to avoid future moral coercion from the sort of experience with the COVID-19 vaccines. The FDA and the NIH should require the development of drugs and biologics that are free from moral taint and switch to cell lines that are not derived from aborted fetal cells or aborted baby parts. Again, for thee and not for me. Thank you, Crazy Grandma, coming in with the roses. I appreciate you. Yes, so they want what they want, but people who want vaccines and then don't want vaccines, but they want, you see how that doesn't even make sense? You're like, okay, So you're worried about body parts, but you've had stem cells. Demetrix with a crane, I appreciate you. It's a conflict of interest. Oh, the next word, conflict of interest. A 2018 report in Science found that more than 2/3 of FDA reviewers later ended up at the same companies whose products had been reviewing while they were working for the government. The revolving door is one mechanism by which pharmaceutical companies capture the agencies that regulate them. The FDA should impose a lengthy cooling off period for reviewers, preventing them from working for companies that they regulated. In 1997, the FDA relaxed regulations to permit broadcast drug advertisements in which Big Pharma began to direct-to-consumer advertising, making the United States and New Zealand the only countries where such practices are legal. Following the 1997 changes, Big Pharma became the largest advertiser of all major media organizations. This buys considerable influence in the newsroom, whether media companies acknowledge it or not, and distorts independent reporting on public health issues. The FDA or Congress should regulate where and how paid advertising is used by pharmaceutical companies more stringently, especially on media outlets. So what they're saying is, Big Pharma shouldn't get to advertise, but only the Big Pharma that they don't agree with. So don't get that twisted. It's, well, this Big Pharma head here and this Big Pharma head here, but we only want, thank you for the first gift, Stacy. I appreciate you. Again, guys, if you're just joining this, if you're just joining my live, I read Project 2025 out loud. I started it back in July. I'm starting it again because I thought maybe we wouldn't have to have it and wouldn't need it, but guess where we are. So I am reading it, and you're more than welcome to come into the live, listen, you can share, you can like, you can follow, but to comment, you have to subscribe because it was just getting ridiculously flooded, which it was just, I literally couldn't get through any of it if I tried to. Even if I could read some of that, I couldn't do it. So that's why that's there. And that's the only reason that's there. So you can listen all you want. You can screenshot all you want. You can listen at YouTube if you want to later on. However you choose to do it. I'm doing it this way to try to weed everything out and to make it easier for me. So if you would like to support me, you are more than welcome to do so. If you just want to sit back and listen, I'm all for that too, guys, because knowledge is power. National Institute of Health, so the NIH, bottom of 460 is where we are. The National Institute of Health, NIH, is the world's largest biomedical research agency and is made up of 27 different components in the Institute's centers. Despite its popular image as a benign science agency, the NIH was responsible for paying for research in aborted baby parts, human-animal chimera experiments, and gain-of-function viral research that may have been responsible for COVID-19. All that is a bunch of word salad. Blah, 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 blah. Medical tests are done for medical reasons, and it may have been the reason for COVID-19. Okay, so show us. Exactly. It's how they want it, when they want it, not what makes sense. Occam's razor, guys, is always the best source you ever think. What's the most probable reason that somebody would want that? Okay, well, you want this firm tested and you want this pharmaceutical over here because you want control and data. Not because, oh, you think at some point in time some alien aborted fetus came in and somehow... No, the simplest answer is usually the reason. You know, bioethics reform. Research using fetal tissue obtained from elective abortions is immoral and obsolete. Research using human embryonic cells also involves the destruction of human life and should not be subsidized by taxpayer dollars. Good science and life-affirming ethical research are not mutually exclusive. Say that again. Good science and life-affirming ethical research are not mutually exclusive. In fact, ethically derived sources such as discarded surgical tissue and adult stem cells made, I don't know what this means, pluripotent, not tissue obtained from elective abortions, have contributed to the most successful treatments for a variety of ailments. Okay, so they're saying you have to use different, and ours is better because we think so. When there's no data that supports this. This is just what they're saying from a Christian standpoint. That's what they're referring to. Congress authorized HHS to choose not to fund extramural abortions, derived fetal tissue research that fails ethics advisory board review. And in 2019, the Trump administration's HHS chose that course. Subsequently, however, the Biden administration restored the unrestricted funding of abortion-derived fetal tissue, HHS. So, thank you for the hearts, Jekyll. I appreciate that. Or the hearts, the roses, if I could even pay attention today. So, this is what they're saying. Dumpster fire. We love the dumpster fires. I love the dumpster fires. I love them. I set those goals, guys, because every time I do it, y'all will come in and you'll just flood it with me. And I was like, I have to keep resetting. So I set some pretty high goals. If it reaches it, it reaches it. If it doesn't. But I just put there because if I don't and then a goal is reached, it's like, set a goal. And I'm like, I just want to read. Set a goal. I'm like, I'll set impossible goals. I'm going to start setting really impossible goals so that we don't have to worry about things like that. Okay, top of page 461. Under the 2025 Presidential Transition Project, Project 2025, the HHS should promptly restore the Ethics Advisory Committee to oversee abortion-derived fetal tissue research, and Congress should prohibit such research altogether. It should end intramural research projects using tissue from aborted children within the NIH, which should end its human embryonic stem cell registry. That's important. Aggressively implement a plan to pursue and fund ethically alternative methods of research in order to ensure that abortion and embryo destructive related research, cell lines, and all the test methods become both fully obsolete and ethically unthinkable. So what they're saying is there are people who donate their fetus that is no longer viable or they choose not to have. Thanks for joining the team, Angela. I appreciate you. Dumpster fire. I don't know why that makes me laugh. It's just a fucking raccoon that's just on fire. So they don't want any stem cells being used from aborted fetuses. When in reality, you have to sign off on that. So somebody went, yeah, you know what? They can use that for research. They can use that for research. Because some people, believe it or not, who do have to have some abortions would choose to let their child's legacy go on because they considered it a child because it was very much a wanted child. But an abortion had to happen because something happened. So there are people who electively do that ahead of time so that it's like if you donate your organs, you know, somebody donates their eyes or kidney. Some people do that with their fetal tissue so that their child can live on, the child that was very much wanted. So saying that to get rid of all of it just slows down medical progress intentionally and just takes it off the table altogether, which is absolutely asinine. In addition, the administration should reconvene in a new National Council on Bioethics, the NCB, to discuss new and emerging areas of ethical concern to assess whether the ends justify the means when it comes to the promise of therapies and cures, and establish what is limiting principle should guide research and health policy. Because the male-female dyad is essential to human nature, and because every child has a right to a mother and a father, 3-parent embryo creation and human cloning research should be banned. Again, mother and father. Not father and father, not single mother, not single father, not grandparent, not caregiver, not dad, mom, not poly, nothing, not single, nothing. They mean married woman, married man. That's what they're referring to. You don't have to get married. I don't know if anybody fucking told you this, but you're not obligated to ever get married. Dumpster fire. Every time it happens, dumpster fire. I mean, that's where we are now, right? That's where we are now. So it's considering it a conflict of interest, and which is just ridiculous in itself. 3-parent embryos. How do you think IVF works? Sometimes people have to get surrogate eggs, surrogate sperm. Do you see it? Like, and I thought we were all for IVF. Now we're not. So it's where they deem life starts. So a new NCB should convene to examine the issues and provide policy recommendations, the new frontier of bioethical questions that our country will have to address in the coming years. Finally, HHS should create and promote research agenda that supports pro-life policies and explores the harm, both mental and physical, the abortion has wrought on women and girls. That is pathetic. That is pathetic. The mental and physical harm of an abortion is bad, but not the mental and physical health of a 13-year-old who gets raped and has to have a child. Think about that. You are more concerned with a procedure that is heartbreaking and painful, so don't get it twisted that it's not, that you do recover from usually in a couple of days, or a child that you didn't want because you didn't ask to get raped and you don't want this child and they're making you have it anyway because you live in a state where you're 13 and yes, you're going to have that child and they make you marry your rapist and then you're stuck for at least 18 years or until he just offs you. So you tell me which is more traumatizing. A procedure that's painful, that you will never forget, and you will be recovering for the next couple of days, or 2 fucking decades. You tell me. You tell me. NIH maintains inappropriate industry that ties what does that mean? Again, sometimes they spell things wrong in this, and it drives me nuts, so I have to read. Because as I'm reading it, I'm usually reading it out loud live for the first time to you guys. I've kind of scanned some things, but I'm reading out live, so. Conflicts of interest. NIH maintains inappropriate industry ties that create serious conflicts of interest. In 2018, it was revealed that a $100 million NIH study on the benefits of moderate drinking was funded by the beer and liquor industry. More recently, the National Institute of Allergy and Infectious Diseases, NIAID, Anthony Fauci's division of NIH, owns half of the patent for Moderna, the COVID-19 vaccine, along with other big pharma patents. Rather than providing grants to university-based investigations to run clinical trials of their own Moderna vaccine, the NIH conducted this research internally, a clear conflict of interest. The NIAID will earn millions from this vaccine's revenue, and several NIH employees and their heirs personally receiving up to $150,000 annually for Moderna vaccine sales. They're only bitching because it's COVID-19. They're only bitching because it's a COVID-19, or it's because it's something that used stem cells. I plugged my phone in. I thought I did. I apologize. Let me see. Did I do it wrong? Why is my phone not charging? There we go. I was just stupid. I was stupid. Don't worry about it. Don't worry about it. So yeah, I mean, Big Pharma makes money, but you're mad because of how they choose to control. Top of 462. In May 2022, documents obtained pursuant to the FOIA request revealed that the NIH director, Francis Collins, NIAID director, Anthony Fauci, and Fauci's deputy director, Clifford Lane, all received royalties from pharmaceutical companies between 2009 and 2014. Nonprofit watchdog Open Book estimates from 2010 to 2020, third parties were paid more than $350 million in royalties to NIH and its scientists, who are credited with its co-inventors. Most problematically, in the years since when they received payments, Collins, Fauci, and Lane were NIH administrators, not researchers, with no plausible claim to scientific or co-discoverers. They're pissed that they're getting paid. They help save the fucking world. Thanks for joining the team, Michelle. I appreciate you. So if they made money off it, we're a capitalist society. Did they help save humanity? Well, here they kind of did. I don't know. If they've already got the technology, that's why we're able to roll out things so fast, because they understood it. Why shouldn't they be paid? Most of the other world's advanced science countries have stricter prohibitions on such conflicts, which help explain the most significant studies of the COVID treatments on natural immunity and the vaccine efficacy have come from mostly outside the U.S. Because everywhere outside the U.S. listened to science. We didn't, and now you're pissed, and you're mad that they made money like everybody else did who got, forgiveness loans, PPP loans. You're mad that they made money. And natural immunity is only a thing when other people have taken care of the situation. Like, okay, yeah, natural immunity is more of a thing now because a lot more people are vaccinated. So kind of helps it out. But they're like, no, natural immunity. I'm like, it's not a thing. It was a global pandemic. It wasn't sex. It wasn't race. It wasn't age discriminatory. It did not matter. It did not matter. They're always going to come back to COVID as the control source, though, because that's where things started to go awry and where we failed. In the United States, we get the biggest, in the United States, in the earth, on earth, we have the biggest fail card for COVID. And people are pissed. I would be mad, too. We watched our whole entire country be shut down longer and not listen to science longer for what? Being a right man and then saying, oh, well, it wasn't ethically derived or they shouldn't make money. Meanwhile, all of you fucking PPP loaners those have been paid off and you had agencies and money that didn't even exist. Keep going. Funding for scientific research should not be controlled by a small group of highly paid and unaccountable insiders inside the NIH, many of whom have stayed power for decades. Sound familiar? The NIH monopoly in directing research should be broken. Term limits should be imposed on top career leaders at the NIH, and Congress should consider block granting NIH's grant budget to states to fund their own scientific research, giving it back to the states. Oh, look at my own little Dr. Pepper. Yay! Thanks for joining the team, E. I appreciate you. So they're mad. I'm just trying to read that. I apologize, guys. Like, my allergies are awful, so I'm like, my eyes a little wonky donkey. It's all right. They always call me crazy eyes anyway. There's a reason. So they're mad that the NIH, who does the research, it is political, but They're science. They do the research. They think they should have term limits. Keep them dumb. Keep them uneducated. Don't keep them on the up and up. Got it. Noting in this system would prevent several states from partnering to co-fund large research projects that require greater resources or impact larger regions. Likewise, the establishment of funding for scientific research at the state level does not preclude more modest federal funding to the National Institute of Health. The two models are not mutually exclusive. Again, trying to give the rights back to the states. Okay, you have to have one and you have to have one, but you don't have to have one. And if you have one here, it's the same thing as more control, more data. When you give rights back to the states, it is more condensed power. Period. That's what that means. The CDC, sorry, there's like a weird glare. Excuse me, I'm just going to bring this to my face. The CDC and the NIH foundations, whose boards are populated with pharmaceutical company executives, need to be decommissioned. Private donations to these foundations, a majority of them from pharmaceutical companies, should not be permitted to influence government decisions about research funding or public health work policies. Then explain Rick Scott, motherfucker, because he was pharmaceutical his entire life and then went into politics and almost just became majority speaker. So talking out of their ass every single which way, but because most people can't understand the comprehension behind it, they're just gonna be like, oh, it's bad, get rid of it, get rid of it. Because what's the next word? Woke policies. This is a fucking human adult manual that says woke policies. Under Francis Collins, NIH became so focused on the hashtag #MeToo movement that it refused to sponsor scientific conferences unless there were a certain number of women panelists, which violates federal civil laws against sex discrimination. #MeToo was mostly a female movement. There should be females on the panel. The quota practices should be ended, and the NIH Office Equity, Diversity, and Inclusion, which pushes such unlawful actions, should be abolished. They were pissed that women were talking about women issues. Sound familiar? Does it sound familiar at all? Like autonomy? No. So when we say we should have women on a panel about women, but then you get mad, you're like, it should be abolished. Control. NIH has been the forefront in pushing junk gender science. Instead, it should fund studies of the short-term and long-term negative effects of cross-sex interventions, including affirmation, puberty blockers, cross-sex hormones, and surgeries, and the likelihood of desistance if young people are given counseling that does not include medical or social interventions. The trans population deserves to exist. The trans population deserves to be treated like human beings. Because why? Trans people are fucking people. And the fact that you've got politicians fucking ass hairs so twisted up about transgender surgeries and puberty blockers and people of all natures, thank you, Ramona, for joining the team, is absolutely mind-boggling. How many trans people versus how many straight people? So why are you so pressed about somebody who is just living their life, existing how they exist? It's genetics. If you've ever looked into genetics, and yes, I have, because my child has a rare genetic disorder. So I know exactly how fragile genetic coding can be. So yes, there are intersex. Yes, there are XXY, XXXY. You can have both breasts and testes. Trans people exist. And all of this, going through this entire thing over and over and over, is just slamming trans people's right to exist. Because I'm going to tell you what, I have friends that are both trans female and trans male. And my trans male friends never get shit talked. Never get shit talked because they're like, oh, that's a dude. But somehow, because men who transition to being trans women, sometimes they're taller, their voices are deeper. The shit that they get compared to trans men is just heartbreaking. But I would like to see how they want to enforce everybody going to the bathroom that they were assigned to. Because I'm going to tell you, I have trans male friends who, if they walked into a female's bathroom and some magadad saw that, would clock them. Like, well, which bathroom do you want me to use? You said what I was born as. Well, this is what I was born as on my birth certificate. But guess what? junk. It's not junk science. It's science. And they don't like it because it goes against it. And to think that trans people are somehow fucking new, it is so fucking old. They're thousands of years old. Thousands of years. Trans people have existed for thousands of years. You're mad because trans people want rights. How dare they? Sorry, where was I? Okay, bottom of page 462. Centers for Medicare and Medicaid Services, CMS. This is going to get interesting. With the goal being societal safety net, Medicare and Medicaid touch more American lives than any other federal program. Exactly. While they help many, they operate as a runaway entitlement. Never, ever, fucking ever let somebody tell you that Medicaid and Medicare, which people have paid into since they started working, is an entitlement. It's not. You calling it an entitlement means like, it's entitled. No, I've paid into it. Fine, you want to take it away? Give me every fucking dime that I have ever paid while I'm working. From the day I started working when I was fucking 13 years old, give it to me right now. Give it when I was 13, when I was corner tasseling or babysitting. I want that shit to retroact 30 fucking years. Give it to me now. Give it all to me now because somehow you think it's an entitlement. Tell your Nana that her Medicare is no longer going to be there. Tell a special needs parent their Medicaid's no longer going to be there. And then call it an entitlement. An entitlement. Do you mean because they fund correctly and they negotiate costs and they get things done? I don't know, Rick Scott, did you defraud Medicaid, Medicare? Were you like the biggest ever? How many times did you say plead the fifth? It was like how many times? Like 80 times? When you had Medicaid, Medicare fraud? It's not an entitlement. Your grandma deserves her insulin. Special needs kids deserve their medicine and their specialists. It's ridiculous to think that they call that an entitlement. It is care for those who need it. Period. And by the way, just so you're aware, because I have seen this an awful lot, for people, if you are MAGA and you are listening and saying, I want to get rid of fucking Obamacare, but I'm going to keep the ACA. Thanks for joining the team, No Seeds. They are the same fucking thing. The Affordable Health Care Act, the ACA, and Obamacare are the same fucking thing. They're the same fucking thing. So when you say, well, yeah, I want to get rid of Obamacare, but I'm going to keep my ACA. This is why education is important, why knowledge is important, why information is important, because it would allow you to make informed decisions. Not just, just click for Donald and run. Nothing else to be considered. Nothing. I can't believe that people are even having that conversation. Oh, well, I want this, but they're going to get rid of this. No, it's not. It's the same thing. Runaway entitlements that stifle medical innovation, encourage fraud, and impede cost containment. In addition, with their fiscal future is in peril. You mean fraud because people like Rick Scott, not fraud because your Nana needs a new hip. Both programs should be managed so that the individuals are empowered to make decisions for themselves and have quality options with affordable prices driven by competition and innovation. Providers who participate should retain or have restored the freedom to practice medicine and take care of their patients according to their patients' unique needs. You are a fucking liar. You want privatized health care because if you have privatized health care, you can charge where the fuck you want and it's the only thing you got. Medicare. Medicare should be reformed according to the 4 goals and principles. Number 1, increase Medicare beneficiaries' control of their health care. Patients are best positioned to determine the value of their health care services working with health care providers. They also benefit from increased choices of doctors, hospitals, insurance plans. Access to reliable information with respect to physicians, hospitals, and insurers is therefore essential. You mean that because you want them to go with the Medicare Advantage, I think is that's what they're pushing, like to be the only one. Reduce regulatory burdens on doctors. Doctors must be free to focus on treating patients first, not entering codes on computers, and should not be tempted to change their medical judgment based on arbitrary or illogical reimbursement incentives. First of fucking all, and I know this firsthand, so I know exactly the fuck I'm talking about. It is not doctors who are entering codes. Doctors are saying, you need this. And you go, okay, I need this. And then, oh, but it needs a prior authorization. It's got to go to the insurance company. Go see the insurance company. Gets denied. Okay, can I appeal it? Yep, okay. Denied again. Appeal again. and the person behind there making those medical decisions half the fucking time is an hourly employee, circumventing what an actual doctor says. Hey, this person needs this medication or they will die. Well, let's see. Per authorization. This is the reason the doctors go back and forth, because they're fighting with insurance companies about approvals. If a doctor says you need something and you have fucking insurance to do it, even if you don't, if a doctor says you fucking need it, you fucking need it. It shouldn't be some little 23-year-old who's working from home being like, denied, because it creates fucking havoc. I had an appeal one time that went almost a year, and it was asinine, and it wound up getting overturned. But the heartache and the mindset for something that is needed for a medical child is being questioned, because you're like, oh, well, we should remove the burden. No, you don't mean that. You don't mean that at all. Ensure sustainability and value for beneficiaries and taxpayers. So that's number 3. Prices are best for patients when determined by economic value rather than their political power, and when they are known to advance the receipt of reimbursement services. Government's use of non-market methods to determine reimbursement leads to overspending on low-value services and products, and underpayment for high-value services and products stifles beneficial innovation, and because of Medicare's size distorts payments throughout the healthcare system. Immediate entities can manage financial risk and ensure quality of care and important transitioning value-based care within the Medicare program. That's just a bunch of word salad. Reduce waste, fraud, and abuse. Thank you for the crown. I appreciate that, Jennifer. Reduce waste, fraud, and abuse. Maybe don't re-elect Rick Scott. That could be a good start. Including through the use of artificial intelligence for their detection. Oh, Christ. Oh, yep, Medicare, they went full AI. Nope, no doctors, just AI. Come on. Thanks for joining the Team 75 Corvette. I appreciate you. Regulatory reforms. Medicare regulations restrict choice of coverage and care. The next administration should reintroduce and restore regulations and demonstrations from the Trump administrations that were withdrawn, weakened, or never finalized by the Biden administration, including the Medicare coverage of innovative technologies, the MCIT rule. Top of page 464. The risk adjustment data validation, the RADV rule. The Medicare Advantage qualifying payment arrangement incentive, the MAQI demonstration, and the Global Professional Direct Contracting, GPDC, rebranded as the Accountable Care Organization Realizing Equity, Access, and Community Health, or ACO-REACH model. That is a whole lot. Additionally, regulations should advance. Oh, thank you for the confetti. I appreciate you. Additionally, regulations should advance site neutrality by eliminating an inpatient-only list and expanding on ambulatory surgical centers covered procedures list. Medicare generally pays more for inpatient hospital procedures and less for same-day procedures performed at an outpatient setting. Whether a medical service is delivered in a physician's office, a clinic, or a hospital setting, the Medicare payment for that service should be the same. CMS should expand the application of site-neutral payments options for more settings. Such a policy would level the playing field among providers and remove the financial disabilities for medical professionals who would compete with hospital systems. Finally, HHS needs to restore and enhance conscious protection regulations that allow medical practitioners to participate in federal healthcare programs without, here we go, this is exactly why they did it, without being compelled to provide sex changes or similar services. All of that word salad was, no, you can't have your trans affirming surgeries. Thanks for joining the team, Robbie. I appreciate you. Yeah, so explain that one. Legislative proposals. Remove restrictions on physician-owned hospitals. The Affordable Care Act imposed restrictions prohibiting Medicare from reimbursing physician-owned and specialty hospitals. The current restrictions do little more than special interests of large hospital systems and undercut consumer choice of high-quality specialty care. These restrictions should be removed so that physician-owned hospitals can compete with other hospitals in serving Medicare patients. Encourage more direct competition between Medicare Advantage and private plans. Right there, private plans. Medicare Advantage, MA, system of competing medical private health plans, is the major alternative to traditional Medicare for America's large and growing cohort of seniors, people who have paid in their entire life. The program provides beneficiaries with a wide range of competitive health care plan choices, a richer set of benefits than traditional Medicare provides at a reasonable cost. What's reasonable to you is not reasonable to somebody's nana. Equally as important, the MA program has been registering consistently high marks for superior performance in delivering high-quality care. Critical reforms are still needed to strengthen and improve the program for the future. Specifically, top of page 465, what did I tell you? Thank you for the heart, David. I appreciate that. Number one, thank you for the heart. I appreciate you. That's amazing. Number one, make Medicare Advantage the default enrollment option. What did I tell you? Privatize it. 465, page at top of 465, under the HHS services. Number one, make Alex with the glasses. Alex with the glasses. I love it. Make Medicare Advantage the default enrollment option. Meaning, oh, you have options, but you don't have an option. 2, give beneficiaries direct control of how they spend Medicare dollars. So they will make sure that, oh, you have Medicare. Oh, no, you don't need that right now. Save that for later. 3, remove burdensome policies that micromanage MA plans. 4, replace complex formula-based payment model with a competitive bidding model. Bidding. Bidding? Reconfigure the current risk adjustment model and remove restrictions on key benefits and services, including those related to prescription drugs, hospice care, and medical savings account plans. They want you to bank money that you never fucking use. Legacy Medicare reform. Legislation reforming legacy non-MA Medicare should base payments on the health status of the patient or intensity of the service rather than where the patient happens to receive the service. It should replace the bureaucrat-driven fee-for-service system with value-based payments and empower patients to find the care that best serves their needs. Codify price transparency regulations. It should restructure 340B drugs subsidies toward beneficiaries other rather than hospitals, and repeal harmful health policies enacted under Obama and Biden administrations, such as the Medicare Shared Savings Program and the Inflation Reduction Act. All about it. All about it. I'm sorry, guys. I'm just seeing if... Thank you so much for everybody who has followed along. I appreciate you so much. Again, if you are joining us, I am now on the bottom of page 465. I read Project 2025 out loud. Anybody can watch. Anybody can like and follow. Commenting is subscription because I was getting ridiculously flooded by MAGA, just not wanting to ask any questions, just paying MAGAs, and it seems to work. Thank you for joining Thank you for joining, Kim G. Thank you for joining. And so I do this live, but I will also upload it to my YouTube. And if you go to the link, I've done the first 11 chapters already, and it goes... I will do when I read it, what was there. It'll be like, page 1 through 10. Thank you for joining the team, Sandy. I appreciate you. It's like, page here through here, here through that, and that's what that refers to. So you can go and you can listen to all the first 11 chapters. I'm skipping to the 14th chapter because the Health and Human Services portion is probably some of the people will be impacted immediately, and then I'll go back and reread it. Again, 922 pages. We're on page 465. We got a long way to go, but I want to give you guys the information. And again, I appreciate all of you who want to be on here. Gifting is optional. I like it because it allows me to do what I do, and I like to interact. That's totally fine, but it's never an obligation. It's not something you have to do. I would prefer you just listen to the information, maybe like and share. That's fine for me too, because I want everybody to get as much information as possible, because it's where the number one trending things on Google is, how can I take my vote back? No, you can't. You can't. What is a tariff? We can talk about that too. And then Project 2025. Like, these are the things. These are things we should have been talking about. Thanks for joining the team, Lisa. Should have been talking about before the election, and we were. And then it kind of like died down a little bit, but I'm like, okay, and here we are. So, Medicare Part D reform. The Inflation Reduction Act, IRA, created a drug price negotiation program in Medicare that replaced the existing private sector negotiations in Part D with government price controls for prescription drugs. These government controls will limit the access to medications and reduce patients' access to new medication. Everybody take a drink. The negotiation program should be repealed, and reforms of Part D that have meaningful impact for seniors should be pursued. Other reforms should include eliminating the coverage gap in Part D, reducing the government share in the catastrophic tier, and requiring manufacturers to bear a large share. Until the IRA is repealed, an administration that is required to implement it must do so in a way that is prudent with its authority, minimizing the harmful effects of the law's policies and avoiding an even worse unprecedented consequences. Yada, yada, yada. A bunch of boomers are retiring. Yada, yada, yada. They want to make sure that they have some kind of health care, but now they're trying to fuck it up for a system they paid into for 50 years. So, Medicaid. Over the past 45 years, Medicaid and health safety net have evolved into cumbersome, complicated, and unaffordable burden on nearly every state. And which states have the most Medicaid? Red fucking states. Red fucking states. So if you want to talk shit about Medicaid, Medicare, red fucking states. It is red fucking states. They're the biggest welfare queens, guys. That's who they are. They want Trump, 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 but they damn sure want their Medicaid. So remember that. Just remember that. Oh God, what's it telling me now? Apparently it says, hang on, this is why I'm like, I can't read it. So it says, apparently I have 13 minutes to get 2 more subscribers. What the hell that means? You want to subscribe, dude? That's great. It'll go away. It'll go away from my end. That's all I see. Over the past 45 years, okay, so the program is failing some of the most vulnerable patients. It's prime target for fraud, waste, and abuse. It's consuming more of the state and federal budget. The dramatic increase in Medicaid expenditures is due to large part of the ACA, Obamacare. Thank you for the heart hands, David. I appreciate you. Thank you for joining the team. I appreciate you. See, right there, guys. ACA is Obamacare, which mandates that states must expand their Medicaid eligibility standards to include all individuals at or below 138% of the federal poverty level, and the public health emergency, which has prohibited states from performing basic eligibility reviews. The reason that some people obtain Medicaid is because of financial reasons. So, yeah, you should always fund that because then they'll never get services. They want to make you dumb. Thanks for joining the team, bub. They want to keep you dumb. They want to keep you poor. They want to keep you unintelligent. They want to keep you ill-informed. The overlap of available benefits among the various health agencies has led to a complex, confusing system that is nearly impossible to navigate even for recipients. No fucking shit. So you want to make it more? Yay, we did it! Such a success! Yay! First bonus round. 2 subs within 5 minutes. Okay, time to dash. Why is stop seeing shiny things. Eric, because I'm just gonna focus on it. I'm like, okay, apparently I have 4 minutes and 28 seconds to get 2 more subscribers. I'm just gonna do like can I even do something like that? It's like block. I can't see it now. Maybe that's what's happening. Thanks for joining the team, Hot Flash. I appreciate you. Thank you, Kim, for the roses. So where were we now? The overlap of available benefits among the various health agencies has led to the complex, confusing system. Recipients are often faced with a welfare cliff, a benefit loss as they earn over a certain amount, which is contrary to the fundamental purpose of empowering individuals to achieve economic independence. Or here's a thought, we could just have socialistic fucking healthcare. It works for Canada. It works for Norway. It works for Sweden. It works for Finland. It works for Iceland. Works for New Zealand. It works for places. It's worked. It works. Socialistic health, it works. And then you don't have to worry about shit because everybody has the same thing, but you're wanting to make it private, not for everybody. You want to make it a pay-for-play game, but who you want to pay. You know what I mean? It's ridiculous. Wow, there are 350 of you guys here. Can we get 500? Can we get 500 people in here? Can we get 500 people in here? I like that. That's what I would prefer. 500 people in this room right now. Let's share. Flood people, annoy the shit out of people's DMs. So that they come and they get the knowledge that they need so they can know where their Medicaid payments are going to go, where their Medicare payments are going to go, where their Social Security is going to go, where their abortifacients are going to go, where their medications are going to go, where their kids are going to go, what's going on with Head Start. Let's see, can we get 500 people in here? I didn't realize we have 350, 358, 356. Go. Team. We're going to call ourselves Team Knowledge. Yay! Bonus collected. TikTok, please stop being so shiny in my eye. I'm not 2 subs within 5 minutes. 2 subs within 5 minutes. I'm I'm going to go back to reading because I just want to interact because that's more fun, but I want to read too. So I'm like, what? Every time it goes, bing, League D1. What does that mean? Ooh. It says the live will end in 4:55 if I don't match. So I had to do some kind of puzzle piece. We've been talking for an hour. Yay, guys. Yay. Just make sure you like, share. Remember, you can only comment if you're a subscriber, but you don't have to comment. It's fine. It's fun, but it's fun. You don't have to. I just want to read, but now I want to interact because there's 300. I want to get 500 people in here. Let's do 500. Let's do 500. I can dream, right? A girl can still dream even this crazy time. Back to where we were. Improper payments within Medicaid are higher than those of other federal programs. These payments are evidence of inappropriateness of Medicaid's expansion, which, stemming largely from a public health emergency maintenance, the MOE requirements of the Affordable Care Act, has crowded out the primary targets for these programs. Those who are in most need. True healthcare reform cannot be accomplished in a bureaucratic silo or only through Medicaid and health safety net programs. Reform the tax code is also essential to... They want to reform the tax code, making it... Look at Ray sharing the live, and Positive Vibes join the team. Thank you, guys. I appreciate you. If you're just joining us here, I'm reading Project 2025. I started reading this back in July. I've uploaded chapters 1 through 11 all the way up on my YouTube. I'm skipping to chapter 14. Thank you, Rebecca. Thank you, Trey, for joining the team. I appreciate you. I upload those to my YouTube so you can listen to Project 2025 or America First Policy or Agenda 47, whatever the fuck you want to call it. This is the playbook of what's going to happen. And I literally downloaded them and I read them out loud, and I stopped because I didn't think I was going to have to do it, but here we are, we're reading it again because this is what's going to happen, and I just want you guys to be informed. So thank you for the Tiny Tinies, Dave. Thank you, Tiny. I don't... Okay. What's it? Stop doing the talking. It's just like, hey, bonus achieved, popular live, doing this. Uh-oh. Okay, I'm going to read this one thing, then I'm going back to this. It says, I need one more subscriber in less than 2 minutes. We'll see. If it does, oh no, am I going to stop reading? No. True health care reform for reform financing. Therefore, the next administration should allow states to have more flexible, accountable, predictive, transparent, and efficient financing mechanisms to deliver medical services. This system should include a more balanced or blended match rate, block grants, aggregate caps, or per capita caps. Any financial system should be designated to encourage and incentivize innovation in the efficient delivery of healthcare services. Federal and state and financial participation in Medicaid programs should be rational, predictable, and reasonable. It should also incentivize states that save money to save money. They want you to save money, which means by saving money when you have Medicaid, Medicare, what that means is they don't want you to get your services. I said what I said. It should also incentivize states to improve the quality of health care. You a damn liar, I know it. Okay, we're going to the top of page 467. Thanks for joining the team, Kimmy. I appreciate you. Okay, direct dollars to beneficiaries more effectively and responsibly. The current funding structure for Medicaid programs rewards expansions, lacks transparency, and promotes financial gimmicks. CMS should end state financing loopholes, reform payments to hospitals for uncompensated care. Who doesn't have uncompensated care? 3, replace the enhanced match rate with a fairer and more rational match rate. 4, restructure basic financing and put program in more fiscally predictable budget, which should include all forms of disproportionate share hospital payments to hospitals. Okay. Strengthen program integrity. Make the program integrity a top priority and the responsibility of the states to protect the taxpayers' investment. Number 1, incentivize states. An enhanced contingency fee should be paid to the states that successfully increase their efforts to decrease waste, fraud, and abuse. When they say that shit, they mean, oh, success! Yay, success! Please don't tell. I thank you for false. Fa la 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 la. We're fucked. La. When they say they want to, increase their efforts to decrease waste, fraud, and abuse. Again, they don't want you to have your services. The current system's IT development 9-10 matching rate should be allowed for improvements in states' current fraud and abuse and eligibility systems. Innovative programs that show positive return on investments for both state and federal governments should be allowed within erroneous waiver processes. 2, improve Medicaid eligibility standards to protect those in need. Those who are on Medicaid, it's a need. It's a need. It's a need. People aren't on Medicaid because they don't need it. They do because they do need it. Innovative programs for the positive return and Medicaid enrollment continues to climb. It is imperative they are appropriate and accurate eligible standards to ensure the program remains focused on serving those who are in need. To this end, CMS should A, hold states accountable for improper eligibility determinations, B, require more robust eligibility determinations, and C, strengthen asset test determinations within Medicaid. If you've ever tried to get a Tylenol on any of these healthcare containment systems, Medicare, Medicaid, and it's not approved, you're not getting it. So this is just a fucking lie. It's a fucking lie. They don't want you to have services. They want to go private. It's the same with schools. They want to take the funding from people who absolutely cannot afford to do it and give it to those who absolutely don't deserve it. Like the tax bracket that's about to come. You know, if you don't make $360,000 or less, your tax burden, whether Trump became president or not, because he signed it in his last presidency, is coming your way next year. It's about $3,000 or $4,000. It's going to be your tax burden. But if you make over $360,000, you're going to get a tax break. Remember that. So when they talk about reducing waste, fraud, abuse, they're not doing it for any other reason than money and greed. Conduct oversight and reform managed care. Okay, incentivize personal responsibility. CMS should allow states to ensure that Medicaid recipients have a stake in their personal health care and sane decisions related to Medicaid program. Personal responsibility and consumer's choice for Medicaid recipients must go together as a standard component of the safety net, especially for able-bodied recipients. This is what's going to be really important. Many people who receive Medicaid are going to receive Medicaid from here until their existence. They are special needs. They are medically complex. So when you're talking about able-bodied recipients, you're trying to force people to go back to work. You're trying to force people to get jobs that they do not qualify for so that they aren't at risk for losing their insurance. Able-bodied. Because they believe it's an entitlement. They do not believe it is a right that you have paid into. They do not believe that if you have a child or you're taking care of your grandma or anybody who receives Medicaid and Medicare, if they are able to work, put them to work because they are fucking workhorses. And that is disgusting. Able-bodied recipients. Medicaid recipient, and like the rest of Americans, should be given the freedom to choose their health care plans and responsibly to contribute to their health care costs at a level that is appropriate to protect the taxpayer. What about those who don't work because they're special needs and can't? You know? So what are they referring to as an abled body? Add work requirements and match Medicaid benefits to beneficiary needs. Okay, so Nana, sorry, I know you have Medicaid and all, but you're gonna go back to work because you're able-bodied. You need to help offset because we want to get rid of Obamacare, ACA. We want to make it privatized, and it's gonna cost you more. So I know that you're 74 and you don't want to work anymore, but you have to go back to work because you're able-bodied and you should be working until you're 90. That's what they want. They want to create a workforce. Because Medicaid serves a broad and diverse group of individuals, it should be flexible enough to accommodate different designs for different groups. For example, CMS should launch a robust personal option to allow families to use Medicaid dollars to secure coverage outside of Medicaid programs. Excuse me? For example, CMS should launch a robust personal option to allow families to use Medicaid dollars to secure coverage outside of Medicaid programs. Why would a family need to secure outside coverage of a Medicaid program if somebody was able-bodied enough to work? Something's fuckery. Clarify that states have the ability to adopt work incentives for able-bodied individuals, similar to what is required for welfare programs. Welfare is not the same as Medicaid. People who are on welfare are not necessarily the same recipients of people who have Medicaid. Did any adult read this? Did any adult read this? And the ability to broaden the application targeted premiums and cost sharing to higher income enrollees. Add targeted time limits and lifetime caps on benefits to disincentivize permanent dependence. I'm going to go tell a family that I know whose child is on Medicaid and they are adult. They have CP. I understand that you cannot walk, that you cannot talk, that you are in a wheelchair, that you have a voice command, but I would like to cap your payments on your breathing treatments and your G-tube and, your wheelchair if it breaks and shit like that. So that's what you want? You want to disincentivize permanent dependence. Well, I'm going to tell you what, I'm pretty sure somebody born with fucking CP would rather have just not had the fucking CP. Okay? And because they are here and they are human and they should be allowed to exist, permanent dependence, they don't want permanent dependence. They would prefer not to have CP, but that's where they are and that's where we're going to meet them. So we're going to make sure that people who need services, who are babies all the way through 145, get the services they need. Dependence on medical. This is not like dependence on Coca-Cola. This is not like dependence on McDonald's. This is not dependence on like fidget toys. This is dependence on fucking medical equipment and doctors and appointments and specialists. That is ridiculous. Y'all should be ashamed if you fucking wrote this shit. Well, but they're not, so who cares, right? Allow private health insurance. Increase flexible benefit redesign without waivers. And eliminate current waiver state plan processes. Okay, so like I said, allow private health insurance, because what they want it to do is go to all private health insurance. And if you don't have private health insurance, well, then you don't get seen. Congress should allow states the option of contributing. Remember, it's an entitlement, but we should allow you to contribute the money that you work for, that you have worked for as an entitlement, to go to private insurance or benefit all members of the family in a flexible account that regulates healthy behaviors. Okay, I got 5 kids. Healthy. My 6th child is not. My 6th child requires more care than all 5 combined. But you want me to have a health care account to make sure that but what if something happens here? If we have a family account, okay, this one broke an arm, this one got in a jet ski accident, this one has to have whatever surgery, blah, blah, blah. These 2 are pretty healthy, but this one, this 6th child needs help. But these 5, because now you have a family fucking plan, you're going to run out of funds? You're going to ration it to people? Like, okay, sorry, your brother needs oxygen this month, but we had to get your other brother, a cast. This reform should allow catastrophic coverage combined with accounts similar to health savings account. They want you to save money. But they want to take it from you. CMS should add flexibility to eliminate obsolete, mandatory, and optional benefit requirements, and for able-bodied recipients, eliminate benefit mandates that exceed those in the private market. This should include flexibility to redesign eligibility, financing, and service delivery of long-term care to serve the most vulnerable and truly needy, and eliminate middle-income to upper-income Medicaid recipients. Financing. They want you to finance your fucking health care. Think about that. We're already at a time where things are high and low and ridiculous and overpriced and COVID and everything and on to a second Trump term, and you want somebody to finance. You want somebody to go into medical fucking debt so congressmen get a few extra dollars in their book and their lobbyists get jerked off? Fuck that shit. CMS should allow providers to make payment reforms without cumbersome waivers or state plan amendments processes where possible. More broadly, the federal government's role should be oversight on broad indications like cost effectiveness and health measures like quality, health improvement, and wellness should be given the balance of the responsibility for the Medicaid program management to the states. This reform would include adding Section 1115 waiver requirements, and in some cases, such as imposing work requirements for able-bodied adults while rescinding requirements in others, such as non-health care benefit and services related to climate change. Climate change? You were talking about Medicare. Now we're like, oh, services are related to climate change. Hey, dick, if somebody's in a fucking wheelchair and it's flooding, are you saying that they shouldn't be reimbursed? Like, what? They should, sorry, climate change. See, every time they can, every single time they can tie climate change, abortion, LGBTQ community, and women, they're gonna fucking do it. This is the dumbest shit I've read so far. While rescinding requirements and others, such as non-healthcare benefits and services related to climate change. If you've ever spent more than 5 minutes on the fucking phone with an insurance company trying to get anything taken care of, now you're like, whoa, we don't want you to abuse it too much. Oh, look, guys, we hit 406, 406, 406, where 409, 409, 408 people in this room. Share, share, share. Share, share, share. That's right. That's right. That's right. Let's do it. Let's do it. Let's get everybody knowledged up in this motherfucker. Let's get everybody. Like. Share, share, share. Comment if you can. If you can't, don't worry about it. We're going to get there. But I'm going to tell you, although they're dirty fucking secrets, so that when this motherfucker takes office in 70 days, that you are like, oh my God, I can try to plan. Affordable Care Act and private health care insurance. Woo! Let's see. How long is this one? I'm just taking a look, guys, because we've already been in it to an hour. I'm just taking a look, guys. I apologize. Let's see if we can get to 500. I got to read over something really quick. But everybody who is here, make sure that you are liking if you can, sharing if you can, commenting if you can. Thanks for joining the team, Lori. I appreciate you. Exactly. As if life isn't hard enough. Let me try to balance this out. We've got... I'm just trying to see where, like, a good place... would be able to stop with this. I'm just trying to see how far this next section goes on, because I don't want it to be, like, in the middle of it. So we did 10 more pages. We did 10 more. So I think that's what we probably should. I'm going to bookmark it for here. And I want to keep talking a little bit, but as a bonus, let's just take a look and see, because I want to be able to read what's going on. Oh, please. Hold, please. Sorry, I'm just trying to get any kind of news that's happening now, because I want to go on and read this, but this next section is like 469 to like 480, and I don't want it to... Oh, thanks for joining the team. Halo with the coins. I appreciate you guys. Let's just see if I can find anything that I want to... Ooh. I apologize. While we hold, we've only just begun. Okay. So for like the next 5 minutes, I'm just going to go on Twitter. Okay? And we're just going to see what's happening. What? Oh, no. Okay. I'm sorry. I follow Wu-Tang for the Children over on Twitter. I probably won't be posting a whole lot on Twitter anymore because our terms and conditions change tomorrow. And I'm not letting Elon take fucking shit. Boo. No thanks, sir. But, what is this? Tropical Storm Sarah forms in the Caribbean. Okay. Thank you so much, everybody. I appreciate you guys. This is amazing. I kind of want to laugh for a couple of minutes. Let my eyes not quite read so much. You guys are what makes this amazing. I am so appreciative that you want to come on my platform and engage and learn. And again, I love that you guys want to learn and know and get to find each other. People who are in here want to be in here. And that's why I told you, I took that and made it. There will be a time at some point, maybe in the near future, where I take that subscribe off for the comments. But I like to be able to, 700 new members on Blue Sky. I love, and again, guys, I'm not telling you anything they haven't written down, but they think people are stupid and won't go to it. And I want you to just have even a basic understanding of what's about to happen. And anybody who says to you from now on, he said he's not, listen fucking here. A man who deep-throated a microphone and stranded people at Coachella is now going to be the next president. Spare me your what he's not going to fucking do anymore. That's not where we are in this life. We are about knowledge and power. And again, I want to make sure as many people can listen to it as they can. So again, tonight I will make the promise to do that, because it will be a total of 20 pages. I will upload them, boom, boom, right back to back on my YouTube channel, and then we'll go back to, again, chapters 12 and 13. But I just want you guys, even if you're listening, like if you're just listening at night and you want to hear my annoying voice, that's totally great. That's amazing to me too. I'm super excited. But I think this next couple things should just be us looking at the news, shall we? Because my hair she's crazy today. Yep, this is how much hair I have on my head. And yes, I shave my sides because it gets too thick. But a bunch of white MAGA men will always be like, "Oh, look at that fucking lesbian." I've been married to a man for 24 years, but cool. I'm like, hell yeah, still got it. Got the Riz. I got the Les Riz. I can't wait for somebody to call me Rosie O'Donnell, because she's amazing. And Melissa McGarthy, because she's amazing every single day. Miss Piggy, hello. She was my absolute love of my life. I will always talk shit, guys. I will always get loud. I'm not tall. I'm 4'11", and I am 100 plus pounds. I have been 100 pounds heavier than I am and 100 pounds lighter than I currently am. So either way, it doesn't matter. People are going to talk to you and say shit no matter what. So be you and be as comfortable as you can. And we're going to laugh, because if the world's coming to a fucking end, which I feel like it is, I feel like we should just be reading Revelation at this point. Tropical Storm Sarah, looks like 7 p.m. on Friday, Saturday, and Sunday. It's going to hit that Gulf of Mexico and swing back in. I'm like looking at, okay, probably can't see it very well. Let's see what the path is. Oh, it looks like it's about to hit, it says next Wednesday. It's supposed to be like, kind of the same place, right? I'm just looking at the projected path. Let me see. Hurricanes. I think it's tropical storm at this point. Tropical storm. Sarah. Storm. I wish they would have called it Huckabee. It's the fucking Huckabee storm. Sarah. Storm. Tropical Storm Sarah. S-A-R-A. Not with an H on the end. Not to be confused. Sarah is still getting its act together, but will struggle more than expected due to the interactions with land. If it manages to stay far enough away from Honduras, it could still become a hurricane. But the forecast tracks closer to the shore and tropical storm before moving on to Belize. Oh. It won't be a major hurricane when it hits Florida like the middle next week. It may not even be a tropical cyclone by then. If it has some effect to South Carolina late last week, the main concern will be heavy rain. Like, guys. Whew. Okay, so what other news? What other news is happening? Let me just refresh my feed. I like to just see what... By the way, can I just say, dear Mike Tyson, knock Jake Paul the fuck out. I don't care. I don't care how much it costs you. We will go fund you. We will make you our own multi-quadrillionaire if you have to knock him out. And there's legal fees, because, yeah, you should. Mike Tyson should just... Nothing to see here. Nothing there. Let's see what else is trending. Ew, what is that? Delete. Let me see. Again, I'm just going through reading my live tweets as we do this so that we can reconvene tomorrow, because reading too much on the white paper, my eyes. Which department? Oh, God. The DOGE, the DOGE, the Department of Government Efficiency. They named it after crypto. That's Elon and Vivek. Like that, it's not even a real cat. There's no appointment just because it's not a thing. What does this just say? Who? Michael Anton and Sebastian Gorka in the running for Deputy National Security Advisor. I swear I'm going to get a fucking whiteboard and we're just going to put all of the names up here, like all the actual positions, like the cabinets and stuff. We're going to put the names of the cabinet and just put the members and and then just erase it. We don't need it. And then we're like, because what the hell? What the hell? Gorka, a Steve Bannon ally who was also named deputy assistant to Trump in early 2017, has called violence a fundamental part of Islam. And he once worked for Viktor Orban. So that should be in no way an issue, right? Right? Wow. So yeah, like I said, if you are on Twitter or are unaware, they are changing their terms of service tomorrow. And I'm just like, I may be quiet, I may be silent, I may get louder. I don't know. I don't know what's going to happen because, I mean, it's the end of the world and we should have a party, right? But I should go. It is 12:30. You guys have been here for an hour and a half. Clap, clap, clap. We almost have 100,000 likes. That's amazing. So many more people have joined the team. Thank you, everybody who came out today and listened. Thank you, everybody who should do now covered by replacement. Yeah. Agreed. Did you say I do have, well, see, that's the thing is that I posted that on Twitter. It's gender reveal, but it's, thank you for doing the team recovery. It's, we know that there's nobody that is pregnant, but you put them on the card, and because it's a boy or a girl, it's way past the time of abortion. So, side chicks are going to get paid. So just let you guys know. So yeah, that's why I bought those, and I bought a ton of them. And if I see a huge Trump humper, boom, I'm gonna slap that shit on there. And the only thing in there is the number to the family court, for the family courts for child support. I'll let that work its shit itself out. That's what I wanted to do. I'm just trying to create some good chaos because this is going to be fun. There's going to be the level of meltdowns that we're already kind of seeing. What do you mean a tariff is... No, that's what China pays. No. What do you mean my family might get deported? You voted for him. Well, but he said he was getting rid of criminals. Did your family come here legally? No. Well, then they're at risk. But they just came here. Read the fine print and look who it is and who he's stacking his... My one hope. Remember this. Trump keeps picking people who are already in like House and Senate. And his team is like, stop doing that. Please stop doing that. You're decreasing our margins because Matt Gaetz' seat is now vacant. And if he does not make AG, he doesn't get to come back in. I don't. That's going to be a hellscape. Who even knew Matt Gaetz was a lawyer? But remember, Matt Gaetz just did this. He talked with Trump directly, obviously. Thanks for joining the team, Nikki. He did this because he talked with Trump because they were getting ready to drop his ethics findings that they've started since 2021. And if he quits, that ethic, no longer have to do that. Show me the fucking report. Dude, Merrick Garland owes us at least that shit. He fucking owes us at least that shit. Show us what was in there. And the one thing we have to remember is, well, two things we have to remember. There's that, I think it's Article 3, Section 2, or Article 2, Section 3. I apologize, I'm not very well versed, where he can just adjourn recess, right? Everybody goes to recess. That means he can just appoint whoever the fuck he wants without Senate confirmation. And we're like, no, the fuck you're not. So the fact that Rick Scott did not win this majority yesterday speaks volumes. There are Republicans that have seats that fucking hate this man. They fucking hate him with passion. They cannot stand him. And because they cannot stand him, that vote was done in secret. Only 13 people voted for Rick Scott. That you need more than that. And so now it's John Thune instead of John Cornyn, and it's the lesser of the three evils, but at least he's soft on immigration. So it's like, okay, this is Mitch McConnell, bye-bye, bitch. Evil as it comes. But thank you for the team, Reagan. I appreciate you. However, Matt Gaetz, if he does not become AG, what's going to happen then? Look, I think they're getting ready to deflect. Thanks for joining the team, Cassandra. I appreciate you. It is an absolute mind fuck. Like I don't even turn on the news. I don't even have to turn on the news anymore. First of all, news is going to go away. Project 2025 talks about state TV and state media. That was one thing I think I saved, actually. Republicans. It says, Matt Gaetz used to walk around the cloakroom showing people porno of him and his latest girlfriend. One former Republican lawmaker told me he'd show a video and I'd like, that's great, Matt. He's like, yeah, what kind of reaction do you want? The video, according to the former lawmaker, showed a hula hooping woman. Thank you for joining the talk. The video, according to the former lawmaker, showed a hula hooping woman. Thank you for joining the team, Carrie. I appreciate you. Like this fuck? This five-head? Motherfucking five-head? The Venmo hoe? No. No. I refuse. But he's out of a job. If he does not get AG, he's nowhere. And I don't know if that's a good thing or a bad thing. Thanks for joining the team, Caroline. I appreciate you. It is... Sorry, let me go back to my message. Let me see, guys. I thought somebody just asked something. And I apologize. I saw something go by and I couldn't find it. Anyway. If you are on Twitter, I do recommend going to Blue Sky. You can find me there. Billy Nelson, Blue Sky. Mama B Energy too is always the same thing. I was always Mama B Energy. I used to be like B Don't Do Pretty like when TikTok first started, but I was like, Mama B Energy. But I'm like, fuck it, I'm using my real name. Fuck this shit. Fuck this shit. I want my real name used. So yes, go over to Blue Sky. Blue Sky is blowing up, and the best thing about Blue Sky over there anyway, as opposed to like Twitter, is they've already booted like Laura Loomer, Cat Turd, Laura Ingraham. They're like, get the fuck off. No, you're not on this site. Nope. It's pretty much a Democratic, liberal, blue site. People have asked me, do you think that something big is coming? And the only thing I can say is M. Night Shyamalan. Like, I don't know if something's coming. I couldn't tell you. Thanks for joining the team, Darth Mom. I appreciate you. I don't know. Like, I wanna have the hopium they talk about. Like, yeah, I have hopium. Thanks for joining the team, Darth Mom. I appreciate you. I don't know. Like, I wanna have the hopium they talk about. Like, yeah, I have hopium. I have hope. I mean, and I'll always have hope. But at what point you're like, I don't know if this is really gonna... I don't know. So, but I will be back. I should be able to do back tomorrow at 11. In the morning, I'll make a video if I can do it. Hang on. Tomorrow's the 15th. Yes. Okay. Sorry. Planning around work, planning around my kid, try to do things. I do this because I love to do this. And I love that you guys have stayed with me this long. And I'm crazy and I'm loud and I'm obnoxious, and it's okay. Because everybody's different, and I just want to show you that this is what we can do, and we'll do it together. So if you guys have any questions, you can always feel free to ask me. My DMs get flooded, so I apologize. And usually it's just people calling me fat, or my bad teeth, or I'm old, or something's in my nose, or whatever. And cool, whatever, dude. Fucking ratio me. Give a fuck about your small dick. But I appreciate those of you who show up and stay up, and I love you, and I appreciate you, and know that I see you, and know this is not the end, and do I think something else is coming? I mean, shit, Aqua Tofana. Look that one up. I'm not going to tell you that one. Aqua Tofana. But look that one up. So, I appreciate you. I will hopefully see you guys tomorrow. If not, I will see you sometime this weekend, and we will get through this, okay? Take care of each other. I love you.